My first exposure to medicine was in the 5th grade with a simple fracture of the upper extremity. I was treated by one of the preeminent orthopedic surgeons in New York City, and seeing patients coming from all over the United States, all over the world, frankly, for this individual's compassion, clinical outcomes, surgical expertise, that led me to think that there's a special role for a physician in treating a patient and treating a human being, and people will travel long distances in order to achieve that holistic outcome. And I've strived to emulate that throughout my years. I'm incredibly passionate about what I do. It's very gratifying to achieve such great patient outcomes with a level of minimally invasiveness, which is pleasantly surprising to the patient population. Oftentimes no stitches and just a Band-Aid for something that traditionally would require a large incision or a prolonged hospital stay. One of the most touching stories for me was a young individual who came via the emergency room in critical condition. This individual had extensive blood clot in her lower extremity, which migrated to her heart and lungs. This individual struggled to oxygenate, struggled to breathe, and was preparing for a very unfortunate outcome given what she's been told and given what she knew about her situation. We precipitously evaluated and treated the patient and removed not just the blood clot in her lungs, but also removed the blood clot from her lower extremity as well. Within a 2-week time frame, this individual was back teaching her grade school class, and I found that to be incredibly gratifying. Well, in interventional radiology, we use the most modern techniques and the most modern technology to treat patients in minimally invasive fashion for something that would require traditionally a very large incision, a prolonged hospital stay, a long recovery time, and potentially general anesthesia. We're able to achieve this with millimeter-sized incisions, oftentimes no stitches at all, no hospital stay, and with great outcomes that sometimes come immediately. We're very proud of the Women's Health Program here at Mather Hospital. The Interventional Radiology Department performs procedures such as uterine fibroid embolizations for bleeding fibroids, pelvic venous embolizations for pelvic congestion or pelvic venous insufficiency. We perform nerve blocks for people with chronic pelvic pain, and we also perform hysterosalpingograms or tubal recanalizations for individuals who suffer from infertility. We also focus on interventional oncology, which is the minimally invasive treatment of cancer. That includes Y90, which is embolizing or plugging up tumors in the liver and or other areas in the body. We do ablations, which is freezing or using microwave/heat in order to get rid of tumors. And I also have a varicose vein program, which I began as well. My approach to care is that I have a paradigm of what would I do for my loved ones, and I will directly replicate that for my patient. So I always reflexively think, what would I want for my parent? What would I want for somebody that I hold dear and love? And would I do that for someone else? Yes, and I would want to make sure that they receive the same, if not superlative, treatment.